For many, working remotely means setting up home offices in some awkward places sometimes around the house. And it also means sitting more than ever before. We've got Dr. Russell Amundsen. He is a neurosurgeon and National Center Medical Director for UnitedHealthcare, joining us now to help reduce the risk of back pain. Welcome.
Good morning. Thank you for having me.
So many of us suffer with back pain, and it is not uncommon. I'm imagining that more are now because they are sitting in these situations at home in these makeshift home offices. But what should we keep in mind about our posture when we are working remotely?
A couple of core principles. When seated, try to keep yourself aligned, keeping your ears over your shoulders over your hips, and engaging that core to kind of hold yourself up and support your spine. That can alleviate some of the discomfort that arises from, as you said, makeshift offices at home where you don't have that ergonomic design.
Absolutely. This couch is not an ergonomic design, and I just corrected myself in real time. I think it's so easy just to get comfortable and slouch a little, and a lot of us are doing that. Why is it so important to not only be mindful of our posture, but take a break during the day and sort of loosen up?
Well, it's hard as you're going to learn, and standing up straight is hard to do. And so, as you said, you'll tend to start slouching. So maybe every 5 minutes out of 30, it's good to get up, move about, keep yourself active, and to stretch a little bit. Even some yoga or Tai Chi, if you can incorporate that into the day.
And I'm also wondering, if you are suffering from lower back pain, is it better just to rest, or should you also get up, move about, and get a little activity?
A little activity is better. Stay within your comfort zone. Don't overdo it. But if you stay still, there's a tendency for the muscles to actually cramp up and go into spasm, and that can make matters worse.
How common is lower back pain? I feel like I hear all of my girlfriends and I talking about having the same symptoms. And then also, as you answer that, what are the possible care options for us?
Sure. It is common. About 4 out of 5 people during the course of their lifetime will have some low back pain. So it is common. The good news is 95% of the time it's going to get better with self-care. If it doesn't get better with self-care, look toward your options. You may check your healthcare benefit options, but physiatry, in other words, physical therapy or chiropractic, good first options. Keep up with your exercises once instructed. If you don't get better, then check with your primary care doctor. Of course, there are some red flag warnings if there's a concern about cancer, tumors, infection. Obviously, if you've had trauma, those are things that require evaluation.
Okay. All right. And get those massages too. At least that's what I'm telling myself as my own doctor.
No, they can help. They can help. You're right.
All right, Dr. Amundsen, thank you so much for being with us. Really appreciate it and sharing all these helpful tips. And for more information, you can visit uhc.com. We'll be right back with more Midday Maryland right after this. Stay tuned.